profession.
Hi, everyone, and welcome to the Kentucky Nurses Association podcast, The Power of Nurses. I'm your host, Sherry Chandler, Membership Manager with KNA, and I'm so glad you're here. So what if one conversation could change the way you see nursing leadership and your place in it? Well, for today's episode, I'm especially excited because we're kicking off our very first interview with a leader who is truly represents the heart, strength, and future of nursing in Kentucky. I have the honor of sitting down with Dr. Joann Wray, President of the Kentucky Nurses Association and Director of Patient Care at Norton Healthcare. In this conversation, we'll talk about her journey into nursing, what it means to lead at both the organizational and patient care level, and the challenges and opportunities facing nurses across the Commonwealth today. As someone who isn't a nurse, I'm especially looking forward to asking questions that help bring her perspective to life, not just for nurses, but for anyone who wants to better understand the impact and importance of this profession. So whether you're a nurse at the bedside, in the classroom, in leadership, or shaping policy, this conversation is for you. So let's get started. Welcome, Dr. Joann Wray. So before we talk about your role, I would love to know more about the moment you knew nursing was the path for you.
Thank you, Sherry. I really appreciate being here today. I don't think it truly was a moment. It was a bunch of different moments. I think the first thing is I was in the hospital for 30 days when I was in the first grade because I cut my foot on a lawnmower, and I was quarantined to my room. So really, the only people I saw were the nurses and my family. So I was quarantined. So I felt like the nurses provided so much more than just physical care to me and my family, but emotional care as well. So I think that trended through my career. And then I was a teen mom. So I was looking for a career that I knew would be able to provide me stability, not only for myself, but for my daughter as well. So really thinking about blending both of those career path and then looking at my past experiences with nurses brought me to the nursing career. And I would not change it for the world. I tease my sister because she is a teacher and I'm a nurse. And she said I could never be a nurse. And I said, well, I could never be a teacher. So we are definitely both in the right professions.
Awesome. So what does a typical day look like for you as a KNA president? Because I think people would be surprised by what that actually involves. What has been the most rewarding part of serving as a president so far?
So I think to me, it's a blend of two worlds because, as you said, I have a full-time job as a patient care director at a hospital here in Louisville, Kentucky. And my day starts off very early and usually ends very late. I'm juggling my full-time obligations as well as the KNA presidency obligations. And it is a challenge at times, to be honest. But all of us that are members of committees and cabinets and the board and the KNF and the KNAC are also volunteers, and we all have full-time jobs. So it's managing and being flexible, and usually our committees and meetings, we try to make them after our workday, but some of them are due during our workday as well. But it's just being flexible and being able to work together to ensure that all of the meeting times correspond with what we do in our full-time jobs.
So what is one experience early in your career that shaped the kind of nurse you are today?
I think really having the leaders and the nurses that taught me every day what to do for our patients. And also I had one patient that was extremely, they didn't have a lot of family and they were at the end of life. and really getting to understand what that family goes through, because I hadn't experienced that. And I think when people don't have life experiences, they don't understand what that other person is going through. So having them and taking care of their family for an extended period of time really gave me that understanding of they became my family and I became part of their family. So I think that really shaped me into the nurse and the leader that I want to be, because I don't only want to support the staff, I want to support the patients that we serve as well.
Yeah, that's good stuff. So, what's one issue in nursing that you're especially passionate about right now?
I would say workplace safety. We have to be able to provide a safe environment for all healthcare workers, whether they work in the hospital, whether they work in a clinic, whether they are students coming into the hospital, taking care of patients as they're going through their nursing curriculum. We have to have a safe environment for all healthcare workers and our patients and their families, so they feel safe to come in the hospital. And we need to be able to provide that safe environment. It really needs to be an understanding community-wise as well, that there is an issue with safety in general in the community, not just in healthcare, but unfortunately, if you watch the news, there's random shootings every day. So I think it's really being able to provide that safe work environment as much as possible, but then supporting the staff if there happens to have an unsafe event occur, being able to support that staff and provide them the resources they need to get through that event and the future.
Yeah, agree. I mean, every time I turn on the news, it's like you're seeing violence towards nurses. And yeah, I'm so thankful for the KNA and all of its efforts that they are putting into making our workplace safety our nurses feeling more protected.
Right, absolutely. And we have to be there.
Yeah. So what's one misconception about nursing you would love to clear up?
Well, I think that some people think nurses just follow orders of what the providers, but nursing is an incredibly complicated profession. It takes clinical judgment, critical thinking, leadership, and advocacy every day. We're either advocating for our patients, we're either advocating for ourselves. We are problem solvers, we're educators, we're innovators, and we are patient advocates, and we are self-advocates for what we need. We often coordinate complex care between patients. We catch early warning signs. It's not the physicians that are there for 24 hours, it's the nurse. So they are they have to be on top of their game and able to catch those warning signs of a patient that's decompensating, and then speaking up to ensure our patients are safe and that we are heard. And I think one of the other things is people underestimate the emotional toll and demands on nursing as well. It's just not the skills. We have to be resilient, compassionate, and nursing is a profession that's grounded on evidence-based practice, but it's driven by our humanity towards our patients. So it does take an emotional toll, and we take that home with us. If we've had a bad day or if a patient is not doing well, we take that home because we are human.
Yeah. That's good. So you've spoken on the advocacy for patients and bedside and all of those fields. I'm wondering, can you tell us how the KNA advocates for nurses? Like, what does that look like behind the scenes?
Our advocacy is very intentional, and we are active behind the scenes. So we start by listening to nurses, listening to other healthcare professionals across the state about what they're experiencing, whether it's at the bedside, in education, in leadership, or even in advanced practice roles. We want to be able to shape our priorities based on real life issues and concerns of the 93,000 plus nurses in the state of Kentucky. And then we work closely with our governmental affairs cabinet, our board, and our committees to really identify what are the top 3 or 4 priorities that we want to look at for that year. And then we move forward. We talk about what bills we can put in place, what legislation is out there that may have parts of what we are working on, how we can support the Kentucky Hospital Association or other associations that may have priorities that align with our priorities. And it's developing those relationships with those other associations and with our legislators. It's very important that we continue our relationships with our legislators and the other associations.
Yeah.
And then just be invisible.
Yeah. And, I'm not a nurse, but I appreciate all the advocacy, being behind the scenes and being a part of what KNA does for nurses. We've done so much, but can you share an example where KNA advocacy really made a difference?
Oh, yes, absolutely. So the state of Kentucky is the first state that has the decriminalization bill. So I'm happy to say that the Kentucky Nurses Association was a huge advocate in that. And what that means, for those of you that don't know what that means, is it's not being able to be criminally punished for a medical error. And that really came through when the nurse in Tennessee was charged with criminal charges for an absolute error. She did not intentionally do what she did. So as the state of Kentucky and the Kentucky Nurses Association, we thought, that is wrong. We are all human. We all make mistakes. We don't go in to nursing and the healthcare profession to harm people. So really understanding how we can have a bill that is going to support nurses and the healthcare profession when a medical error occurs. And we, like I said earlier, we are the first state to pass that bill. So I'm super excited about that.
Yeah, me as well. So can you go a little bit more into that? Like, why is it so important for nurses to have a voice at the legislative level?
Laws and policies influence everything we do as a nurse, whether it's workplace safety, staffing, scope of practice, education, and how we're held accountable as nurses. And we need to be a part of that. We need to have a seat at the table and to have those conversations. Not only does it affect how we practice, it affects our patients as well and what kind of care they're going to get. We are in a crisis where we could have rural hospitals closing due to federal funding. And what kind of issues are the patients going to have when they're going to have to drive 3 and 4 hours to get the medical care that they need? So really understanding that piece of it as well. It's not only nurses, but it's also the patients that we serve that we need to advocate for.
Yeah, that's good. That's good. So I'm going to swing back around and talk about you a little bit.
Okay.
What keeps you going on hard days?
It's the nurses. It truly is. Whether it's at work or whether it's through the KNA, I'm very passionate about supporting nurses, removing barriers, ensuring that they have everything they need to do their job to serve the community. That's what we're here for, is to serve the community. One day I may need health care and I want to make sure, or my family members, and I want to make sure that the nurses that are caring for my family members have everything they need to do to take the best care of the patients and my family members.
Yeah, and and being on the receiving end of that, I'm very thankful for the skills that the nurses have. My mom has dementia, and I take care of her right now, and so it's so important to have nurses that are skillful in training family members and being there for family members. So thank you for sharing that.
And probably the emotional support they give you.
Yes, absolutely.
because you need that emotional
Absolutely.
support as well. So being able to provide that emotional support, that's huge.
Absolutely. So, what's something you wish more people understood about nurses?
I think it really goes back to that that nurses carry that emotional and mental and physical stress as well every single day.
Hmm. Hmm.
We go in and to work every day and we put what's going on in our life aside to care for someone else's family member or every day. So it's really being able to put that emotion aside, walk in the front door and say, I'm going to give my best 100% of the time today to all my patients. And like I said earlier, it is not a job.
Hmm.
It's deeply human work where we're creating connections every day with our patients and our family members. And it can put a toll on that nurse at the bedside.
Hmm. Yeah. So, for nurses who are not members of KNA,
Mm-hmm.
what would you want them to know?
I would want them to know that we are their voice of Kentucky. I want them to know that we are advocating for them every single day. We want to protect the profession, this beloved profession of nursing. And it's whether you're an educator, a bedside nurse, a leader, you're an advanced practice nurse, we are there for you. And you are not in this profession alone. We will stand by you in your difficult times and the best of times.
Hmm. So, why does being involved in an organization like KNA matter, especially right now?
I think, like I said prior, it's we support one another. We
Hmm.
advocate for safer practice, and we make sure nurses are heard and their decisions are made. Our decisions at the KNA are made with the nurse in mind and the patient in mind.
What would you say to a nurse who feels disconnected or unsure where they fit?
I think nurses go through seasons just like anybody else. And I just want them to know that while they're still trying to figure out where they fit, their experience matters, their voice matters, and there is a place for them somewhere within the Kentucky Nurses Association, whether it's on our Ethics and Human Rights Committee, whether it's in our event planning, whether it's in our Governmental Affairs Committee, or maybe it's just being a member and coming to the chapter meetings and trying to figure out where they fit. So there is a place for every nurse in the state of Kentucky in the Kentucky Nurses Association.
Yes, ma'am, there is. And it's a great place to be.
It sure
It's a
is.
great place to be. So, one last question.
Mhm.
If you could give one message to every nurse listening right now, what would it be?
I would say, like I said previously, your experience, your concerns, your perspective, we value those. Whether it's your voice, like I said, if you're a bedside nurse, a leader, in advocacy somewhere, or simply supporting one another. Nursing is strong when we speak up. Don't underestimate the impact you have because your voice can shape the future of our profession and the health of the Commonwealth.
Wow, that's very good stuff, Joann. Thank you so much for being here and for sharing this great information. And thank you so much for joining us for this conversation with Dr. Joann Wray. Her insight, leadership, and passion are a powerful reminder of the impact nurses make every single day across every role in every setting. As we've heard today, nursing is more than a profession, it's a voice, a community, and a driving force in shaping the future of healthcare. And through the work of the Kentucky Nurses Association, that voice grows stronger. If today's conversation inspired you, we encourage you to stay connected, get involved, and continue being part of an important work happening through the KNA. Be sure to subscribe to our YouTube channel so you don't miss upcoming episodes. where we'll continue highlighting nurses from across Kentucky, sharing their story, their challenge, and their impact. And if you know of a nurse whose story deserves to be heard, we'd love to hear from you. So thanks again for listening. And remember, every role matters and every voice deserves to be heard. We'll see you next time on KNA, The Power of Nurses.